Welcome to the Bioscan Hub channel. And hey, if you find this helpful, don't forget to subscribe to support us. Now, every single lab student learns about anemia, but today we're going to look at it a little differently. I want you to think of it less as a final diagnosis and more like the first big clue in a really complex medical mystery. Our job in the lab is to follow that clue all the way to its source.
So the big question is always why? Why is this patient anemic? Are their red blood cells being destroyed way too soon? Is the bone marrow, the factory, just not producing enough? Or maybe there's a shortage of the raw materials needed to build them in the first place. To get to the bottom of it, we need the right set of tools. So let's open up that diagnostic toolkit and see what we've got inside.
All right, first up, we're going to investigate the scene for any signs of destruction. If we have a hunch that a patient's red blood cells are breaking down prematurely, that's a process we call hemolysis, well, there's a classic test we can use to find the evidence. And that test is the acidified serum lysis test, but pretty much everyone just calls it the HAMS test. It's specifically designed to help diagnose a really rare disorder called PNH, where red blood cells are just dangerously fragile. What the test does is it creates a slightly acidic environment inside a test tube, which in turn activates a part of the immune system called complement. We're essentially asking the cells one question: will you self-destruct if we put you under just a little bit of pressure? The procedure itself is actually pretty clever. We take the patient's red cells, mix them with some serum, and then we add a little bit of acid. This basically wakes up the complement system, a group of proteins just hanging out in the blood that can destroy cells. After we let it incubate for a bit at body temp, we just look for hemolysis. Now, for a healthy person, their cells are robust, they're tough, nothing happens, they pass the test with flying colors. But if those cells do lyse, we've got ourselves a positive result. And this is where the real detective work kicks in, because we never rely on just one test. We use a whole suite of tests to narrow down the suspects. So, a positive HAMS test plus a positive sucrose hemolysis test, that points very strongly to PNH. But what if you get a positive HAMS test with a negative sucrose test? Well, that suggests a completely different and also very rare condition called HEMPES. And that distinction is absolutely critical for getting the patient the right treatment. Of course, like with any test, it's not perfect. You can get a positive HAMS test that pops up in other conditions, like certain leukemias, or honestly, even if you're just working with an old sample. But here's the key things to remember for PNH. The destruction is strictly dependent on that complement system we activated. In those other conditions, the cells might just be fragile and break apart anyway. It's that specific mechanism that really zeroes us in on PNH. So what happens if there's no evidence of destruction? Well, our investigation then moves away from the crime scene and over to the production line. Are the cells even being built correctly? This brings us to two absolutely essential raw materials: vitamin B12 and folate. Just think of B12 and folate as the fundamental building blocks for making red blood cells. You need both of them for things like DNA production and just normal cell function, and that's exactly why they are almost always tested together. If you have a deficiency in either one, it can lead to something called macrocytic anemia, which is where the bone marrow starts producing these abnormally large, kind of clumsy, immature red blood cells. Okay, so what causes these shortages? For B12, a really common culprit is something called pernicious anemia. It's an autoimmune issue where the body just can't absorb B12 properly. It can also be due to a strict vegetarian diet, since B12 is mostly found in animal products. Folate deficiencies, on the other hand, are often linked to things like malnutrition, alcoholism, or the really high demand for it during pregnancy. Knowing these different pathways is just key to the whole investigation. Now check this out, because here's a fascinating twist. You'd think high levels of a vitamin would be a good thing, right? Well, not always. Sometimes elevated levels can be a big red flag. And look at the incredible link between these two right here. A major cause of high folate is actually a B12 deficiency. So why is that? It's because your body needs B12 to actually move folate from the blood into the tissues where it can be used. Without B12, the folate just gets stuck in the serum, totally unused. It's an amazing clinical clue that can point you exactly in the right direction. Okay, so we've checked for destruction and we've checked the building blocks. But what if both of those look fine? Well, there's one more piece to this puzzle: the production signal itself. And that signal comes from a hormone called erythropoietin.
Erythropoietin, or EP for short, is basically the production manager for red blood cells. It's a hormone made by the kidneys that sends a direct message to the bone marrow saying, hey, production is low, we need you to ramp it up. Its level is what we call inversely proportional to your red cell count. So when red cells are low, EP should be high. It's a perfect, elegant little negative feedback loop.
The absolute key to interpreting an EPO level is asking one simple question. Is the body's response appropriate? An appropriate response means the kidneys are correctly signaling for more red cells because of anemia or low oxygen. But an inappropriate response, that means something else has hijacked the system, like a tumor that's just pumping out the hormone, going rogue, even when it's not needed at all. And this distinction is exactly what makes the test so powerful. An appropriately high EPO level is what you'd totally expect to see in most anemias, or say in someone living at high altitude who's adapting to less oxygen. But an inappropriately high level, that can be a sign of something much more serious, like a kidney tumor or a polycystic kidney disease that is pathologically just churning out this hormone. And here's a quick clinical pearl for you, something to just file away. Erythropoietin levels aren't static throughout the day. They actually have a circadian rhythm, and the levels in the late evening can be up to 40% higher than they are first thing in the morning. That's a pretty significant variation to keep in mind, especially when you're comparing results over time. So there we have it, our three main lines of inquiry: destruction, building blocks, and production signals. Let's put it all together now and see how this toolkit gives us a really clear diagnostic strategy. So here's our toolkit in a nutshell. The HAMS test checks for that specific cell fragility, pointing us toward PNH. B12 and folate levels let us investigate the supply chain for any nutritional gaps. And the erythropoietin level tells us if the production signals from management are firing correctly. See, each test answers a very specific piece of the puzzle. I want to leave you with this idea. It's captured perfectly in this quote, which is technically about coagulation, but it really applies to all of hematology. Our goal is to maintain the fluid state of blood. It's all about balance, right? Homeostasis. The tests we've just talked about are simply the tools we use to figure out exactly where and why that delicate balance has been lost. And that brings us to our final thought for today. These are classic foundational tests, but technology, as we all know, is always advancing. Flow cytometry has now largely replaced the HAMS test for PNH, and new molecular tests are popping up every single day. So as you continue in your careers, the most important skill isn't just memorizing tests. It's mastering the critical thinking to connect the results, to understand the pathology, and to be able to tell the complete patient story. Thanks for watching.